Good morning. I'm Liz Milliken.
I am a registered psychotherapist in Ontario. I am an associate member of the Association of Sex Therapy in Ontario. And today I'm going to be talking about sex, myths and misconceptions. This talk is intended for an adult audience, and it assumes that the person is in a long-term relationship that is free of violence or coercion. So those are just a few points that are relevant to the context that this talk is intended for. So to get started, we're going to start with expectations. So a lot of people believe that the first time you have sex will be amazing, and that if you don't have instant chemistry in the bedroom, then you should just move on. So this assumes that sex doesn't improve with time and communication. So an important aspect of a sexual relationship is to be able to communicate to your partner what you like and what you don't like. So this, in contrast to many movies where the couple just starts kissing and everything is flawless and wonderful and they have the most wonderful sexual experience without saying a word, most people have to actually talk about what they like and what they don't like in order to have really amazing sex. It doesn't just come by, divine knowledge. People actually have to communicate about it and discuss what they like, what they don't like, and it's also a learning process of learning what your body responds to and what you enjoy. So next, in terms of
Erectile function. A lot of people have the belief that if an erection isn't maintained until orgasm, then you have erectile dysfunction. So I know other sex therapists, they'll refer to this
as erectile disappointment, because losing an erection does not mean that someone has a medical issue that is causing the problem. It can just be a normal part of the sexual response cycle, where if a man is giving pleasure to his partner, if he's not being touched at the same time, it's actually quite common to lose the erection because he's not being physically stimulated. And so it's not a sign that there's something wrong.
There are different ways to experience sexual pleasure, and it's not something to be of concern. Though it can be disappointing, and it is a topic that often comes up during sex therapy. And a lot of people also believe that the only way to treat erectile dysfunction is through medication. So
that depends largely on what the cause of the erectile dysfunction is. Is it an issue of blood flow, or is there some performance anxiety that causes the person stress so they have a harder time being aroused? So in terms of how the human body functions, if someone is under a lot of stress, then their body goes into a fight, flight, freeze response, which sends the main amount of blood into the person's core, so that way they're ready to respond to whatever crisis is going on. And so that removes blood from the extremities, like the fingers, the penis, the toes. So if you're trying to get blood flow into the penis in order to maintain an erection, that's not going to happen if you're in a high stress situation, because your blood flow is to your core in order to protect you. So there are a lot of sex therapy techniques to help people relax their body and calm themselves so that they can stay in the moment. So there can be other pieces as well, such as for treatment for erectile dysfunction, pelvic floor floor physiotherapy can be helpful, as well as becoming more aware of the client's arousal cycle. So when it comes to premature ejaculation, an increase in awareness of arousal combined with an increase in muscle control is something that has benefited a lot of people. And so on to male arousal.
So many people have the belief that men are always in the mood, and if they aren't aroused by looking at their partner, then that's a sign that they're no longer attracted to their partner. And I think a lot of this comes from
a misunderstanding on how the male body functions, as well as female insecurity. So if there isn't instant arousal by the man, this does not have anything to do, or it does not necessarily have anything to do with attraction to the partner. Especially as men age, they're going to have a slower body response towards arousal, and other factors such as stress, exhaustion, and things like that can contribute to a slower process for men to become aroused, and they can also need that physical stimulation in order to become aroused.
So in terms of anatomy, the size of a person's genitals does not determine their sexual prowess. So sexual satisfaction
Is something that's subjective and not solely dependent on the genital size. And communication, emotional connection, and mutual consent play significant roles. Again, couples have to communicate about what they enjoy, what they don't enjoy. Even if someone doesn't have or doesn't feel comfortable with their anatomy, they don't feel like it's big enough or good enough, there are more ways to interact sexually than just penetration. So it's not the sole determinant of whether or not someone is able to experience sexual pleasure or satisfy their partner. There's also a common belief
that the vagina gets loose from sex with multiple partners. The vagina is a muscle, which it can be stretched and strengthened.
the muscle does tend to be weaker after childbirth. So there are pelvic floor exercises that can be done to strengthen it. As well, if a woman is not sexually aroused, then the vagina it's shorter and it doesn't feel as contained for the man. Whereas if foreplay has been done, the woman is aroused, it lengthens and it feels more contained to the man. So if it's feeling too loose, it could be a sign that there's inadequate foreplay, or that the woman would benefit from pelvic floor physio. So a lot of people also think that
Sex should always be spontaneous and effortless. And it's just simply not the case. It's very common for couples, whether they've been together for a long time or a short time, to run into problems in their sexual lives.
So if you've been together for 10 or more years and everything has been great until now, consider yourself very fortunate, because communication and scheduling time together, it can really be an important piece. So a lot of couples, after they've had children, they're too exhausted and they don't prioritize their sexual intimacy. And so some people think, oh, well, if you've scheduled the time for it, then, it's not romantic, it's not valid to do that. But scheduling time is a sign that you're treating something as important. And so there isn't any shame in scheduling time to be together with someone. Like if you were planning to go on a date, you can schedule a date, or you can spontaneously go on a date. It doesn't make a difference whether it was scheduled or not scheduled. Both are valid ways of spending that enjoyment with the person. In terms of
Physical fitness. A lot of people think that physical fitness is only relevant to sexual attraction. But in fact, if you have strong muscles, this helps with
stamina and a level of pleasure. So for women, if you have stronger Kegels, you will have stronger orgasms. For men, there's Kegels and there's pelvic floor physio, which is strengthening the core of a person, which can help with sexual endurance. There are specific exercises that I teach to clients in sex therapy, and there's 5 different stages of exercises. So starting with the squeeze technique, moving to the quiet vagina technique. These techniques are used to help the couple bond in sexual intimacy and to help increase the man's body awareness in terms of when he is about to ejaculate and to strengthen the muscles that help him to retain his erection for longer if he would like to have longer intercourse. A lot of people think that
sex is all about penetration, whereas sexual intimacy and sexual pleasure involves a lot more than just penetration.
So one of the favorite things that I've heard from other sex therapists is that when one encounter ends, the next begins. So it's this idea that if you are in a loving relationship, you are always seeking intimacy and connection with your partner, remembering that you can flirt, you can touch each other without having to go have intercourse, you can enjoy each other and know each other and make it a part of your daily lives, even if you're not having intercourse on a daily basis. I find that when most people say they're having problems with sex, they're referring strictly to intercourse, whereas sex involves a variety of things. It includes kissing, oral sex, touching of body parts, massaging. There's a lot that is involved in sex. And so when couples start to shift their thinking to, how can I connect? How can I be intimate with my partner? Instead of focusing on the one part about penetration, it helps to relax people, and they realize they're very often more sexually connected than they thought they were. So in terms of skills, sex is all about having the right skills. So I do think skill development is part of it, because a lot of people, they don't take the time to explore and develop skills in their sexual relationship. But things like stress can reduce someone's enjoyment of sex. And a lot of people, they have a hard time knowing how to stay in the moment and open to exploring their sexual satisfaction. So there are some mindfulness techniques that I use in therapy. So one of these techniques is taking 5 minutes to eat a raisin. You take the time to savor the smell, to savor the taste, to experience what it feels like So if you can imagine how that skill transfers to sex, instead of gobbling it up in 2 seconds, what would it be like to really focus on those sensations and those experiences and to not rush through it? Another technique is the body scan, which helps clients gain more awareness of what's happening in their body, what sensations are happening, what different feelings they're experiencing at the time. And these exercises give people a different perspective, and then I teach them about sensate focus, which is a way of taking turns to experience pleasure. So clients can start just by touching the other person for half an hour. And the person who is being touched gets to tell the other person what to do. So this helps couples with communication because the person being touched is directing the other person. They're saying, I want you to do this or that. And so it's a different experience than how most couples interact, where they just kind of try things and be like, do you like this? Do you like that? Well, the person being touched gets to direct how they are touched and where they are touched. Could be a back massage or touching of the hand. It's a different way to help couples build that communication and recognize that sexual connection is more than just that one piece of penetration, because it doesn't start with penetration, it starts with touch, and it moves through a process eventually towards sensual sex, where you're more focused on what you're experiencing. So in terms of female pleasure, some people believe that all women orgasm from penetrative sex. So for a lot of women, that just doesn't happen. Many may not orgasm solely from penetration, and there are women who have difficulty with orgasm in general. Part of that can be an inability to relax during sex. If women aren't able to fully engage and fully feel safe and relaxed during sex, it's much harder for them to have an orgasm. Again, in terms of blood flow, where is the blood flowing? Is it flowing freely through the body, or is it in the core because the person is feeling anxious? There's also a belief that sex is all about male pleasure, and there are many men who enjoy giving pleasure to their partners. So instead of focusing on the act of penetration, I encourage people to focus on connection, building that relationship, being connected with their partner, communicating with their partner, having that openness to say what you like and what you don't like. Sometimes people feel too intimidated to be honest about what feels uncomfortable, and so I help couples find that way to gently bring things up so that they can talk about it with kindness without it being a problem to their relationship. So that way they can enjoy each other and they can communicate and no one feels ashamed or guilty or like they're not good enough. It's a shift towards exploration instead of specific performance-based goals. So it brings me back again to what is part of expectations, that feeling of adequacy. So if someone thinks that every time you have sex, it's gonna be amazing, it's not a realistic expectation. I mean, I would love it if I could say every time you're gonna have sex, it's gonna be amazing and like, it'll be wonderful every time. But you know what? Sometimes sex can be disappointing. It doesn't always live up to expectation or what someone wants it to be. And it's okay. Even a skilled cook can burn a dish. So The idea that you have to have this perfect standard, it's got to be perfect every time, both of you have to orgasm simultaneously every time. You're just setting yourself up for unrealistic expectations and feelings of failure. So I think it's much more helpful to recognize your arousal and your orgasm does not have to be simultaneous. It's okay for one partner to be pleasured and then to switch to focus on the other one. So you don't have to have this set way of doing things. You can explore, you can create. If you think of it as cooking, what ingredients do you want today? You know, do you want it to be spicy? Do you want it to be sweet? So yeah, if anyone has any questions on sex therapy, they can contact me for a free consult. I am available in Ontario. I provide in-person service in Toronto and virtually. Have a good day.